Thank you for coming, everyone. This is about choosing a Medigap policy for 2016. If you are turning 65 this year, this will be very interesting to you. And this is presented by Donna, and I am a broker. I write for several companies, but I am also an authorized agent for United American Insurance Company, and I think they have a wonderful HDF plan, and I think you'll agree once you watch this video. If you would like direct assistance, you can call me there at 805-458-7887, and I'd be happy to assist you with taking a look at what is available to you, and if it turns out that something I write works for you, that's wonderful. But this is about United American. So today I'm going to help you understand your Medicare choices. I know several of you may have gotten a lot of information at your house and it's kind of confusing. So hopefully I'm going to help you unravel the mysteries of Medicare. So when you leave here today, you'll know exactly which direction you want to go, and you'll understand your options, and you'll be able to make the right choice. So you're going to need to have 5 questions answered. For number 1, you're going to want to know what is Medicare and what are my choices? So number 2, you're going to want to know, how do I choose a plan? So number 3, you're going to want to know, how do I determine which plan is right for me? And number 4, you're going to want to know, where do I buy my plan? And number 5, you're going to want to know, which carrier should I use? Hopefully after you watch this video, all these questions will be answered. There's many carriers you could choose from and many policies you could choose from, and hopefully this video will give you a lot of useful information. So what is Medicare? Medicare is a health insurance program established in 1965. It provides health coverage to millions of people aged 65 and over, or people who are disabled, or people who are in permanent kidney failure. You can also apply for your supplement 3 months prior to turning 65. And you can also, with United American, you can submit your application. They will take it 6 months in advance. We do need to have your Medicare card in place, and sometimes you don't get those except for 3 months out from your birthday. So we will hold on to your application until you got your Medicare card, because there's a letter on your Medicare card that we'll need at the end of your number. This is for first-time Medicare supplement applicants that are 64 and a half and above, and not currently on MedSup disability policy. So if you're on a MedSup disability, then you have to wait your 2 years before you can get onto Medicare. So this would not apply to you. These are really for new people turning 65. They can take their application in advance. So let's talk about the different parts of Medicare. As some of you might know, there's 4 parts of Medicare: A, B, C, and D. Medicare Part A is hospital insurance. It helps cover inpatient care while you're in the hospital, and it helps cover skilled nursing facility, hospice, and home care. Doesn't cover everything. That's why it's important to look at a supplement, but it covers quite a bit of that. Now your Medicare Part B, that's your medical insurance. So that helps cover the doctor's services, the hospital outpatient care, and some home health care. So it also helps cover some preventative services to help maintain your health and keep your certain illnesses from getting worse. So when you get your Medicare card, it's going to have A and B on it, and you will carry that with you. That will be your primary insurance. So when you go to the doctor, you're going to show that Medicare card, and that's going to cover most of your doctor bill, and it'll pay 80% of your doctor bill of Medicare approved rates, and then you'll pay the 20%. That's why it's important to get a MedSup, so that it'll pick up that 20%. Now, your Medicare Part D, that is for your drug coverage. So just remember, D equals drugs. And that is run by Medicare approved private insurance companies. And there's plenty of them out there that offer the Part D. I offer it, so if you need help with that, you can contact me. There's also plenty of other people, and it just depends on what drugs you take, which drug plan is the best for you. I would not put you in one of my drug plans just to make money. I'd put you in the best drug plan for you, and I'd be happy to help you figure that out through Medicare.gov, or if you want to try to figure that out by yourself, you would go to Medicare.gov to do that. So, on the different parts of Medicare, we talked about Medicare Part A is a hospital insurance, Medicare Part B is a medical insurance, and you can learn more about Medicare, including Medicare Part C, which is Medicare Advantage plans, and Part D, which is the Medicare prescription drug coverage, at Medicare.gov. And if you need some help once you get to there, you can give me a call. I can certainly guide you a little bit. You could spend days on Medicare.gov. There's a ton of information there available for you. United American does not sell a Medicare Part C Medicare Advantage plan, and we do not sell Part D drug coverage, but I do sell both of those plans by other carriers, so if you want to know more about those, you'd have to contact me directly. So Medicare has Part A, Part B, and optional Part D. Like I say, you do not have to have a Part D. I guess you could go a whole lifetime and not need any medicines and not have a Part D and never pay the fine, because if you never buy a Part D, you will never pay the fine. You don't want to miss buying Part D, and you have to do that during open enrollment. And then there's optional Medicare supplement insurance, which is called Medigap. And that's what we're here today to talk about, Medigap policies and the differences between them. So back to Medicare Part A, your hospitalization. That's you're automatically enrolled. If you're receiving Social Security benefits already, then you're going to be enrolled in Part A. But if you're still working, you're going to need to contact Medicare and let them know so that you can get enrolled in Part A. And if you are still working past 65, check with your HR people to see how it's all going to pan out. Some employers cut people off at 65, and some will carry them past 65. Part A is premium free for most people. If you've paid into Social Security, or you have railroad benefits, or you and your spouse had Medicare covered in government employment. So on Medicare Part A hospital, the coverage, the inpatient hospital room and board, the skilled nursing facility. This is not long-term care. Some people confuse it with long-term care because they go down to the skilled nursing facility for a while. Hopefully that won't happen to you, but if it does, Medicare does pay up to 100 days. Not all of it, but quite a bit of it. The first 20 days are free, and we can talk more about that. Just know it's not long-term care, and if it's long-term care that you need, you can talk to me about that. I do also write long-term care. You're going to need that way before you're going to need skilled nursing facility, or you wouldn't qualify for long-term care. Medicare Part A also pays for hospice and respite care services and some home health care services. If you're just out of the hospital and you've got something going on and need a little bit of help, they're there for you. They pay for some blood, so if you need blood transfusion, Medicare Part A coverage will pay for some of that, and then that's why it's important to look into a Medigap policy to cover what they don't cover. So let's go over the Part A hospital out-of-pocket costs and why it's important to have a Medigap policy to cover these costs, or money on the side. If you have money on the side, you don't need a Medigap policy if you can cover these kinds of things when these things happen. Your hospital, you say you break your leg and you go to the hospital and you stay one day, you're going to pay $1,288 deductible. Let's say 2 months later you have a heart attack and you have to go to the hospital. That first day, 2 or 3 days, up to 60 days, you're still going to pay that $1,288 deductible again. So as you can see, there is a reason to have some other coverage. Now, day 61 through 90, it's going to be $322 per day, and day 91 to 150, $644 a day. So hopefully you're not going to be that ill and be in the hospital that long. Most people are not. Hospice care, terminally ill, and you have less than 6 months to live. Part A is going to send someone out to help out with that. Skilled nursing care, a minimum, this is very important, a minimum 3-day hospital stay. So if you are in the hospital and you have, let's say you had a stroke and you're recovering, but you need to get a little stronger because you're just coming back, your right arm isn't working or something, they're going to put you through a physical therapy program. You're going to want to stay in the hospital 3 full days before you get even to the point of the doctor being able to allow you to go down to the skilled nursing care facility. So if something happens to you and you think you're going to need a little more assistance to get stronger before you go home, you make sure they keep you 3 full days in the hospital if you can. Day 1 through 20 is going to be covered down in the skilled nursing facility by your hospital Medicare Part A. Now, day 21 through 100 is $161 a day for the skilled nursing. So, again, that's going to be your responsibility. So that's why it's important to have some other coverage or some other money on the side. And the blood is usually 3 pints are usually covered by Medicare Part A. Okay, so let's talk about Medicare Part B. That is your medical, and so you'll have a Medicare card. It's red, white, and blue. It'll have your name on it, and it'll have an A and a B on it. You have to pay for B. Everyone does, and it's income dependent. So for most people, it's $104.90 per month, and that's for your Medicare Part B. Now, you can delay Part B enrollment if your employer group medical plan is going to keep paying for you, and if it's less than what Medicare can do for you, then by all means stay there. You can also talk to your HR people and see, what if I went on A and B for Medicare, would you still carry me? And if that's the case, then your health care and your Part D, especially if they'll pay for your drugs as well, that can become your supplement, and you wouldn't need a supplement until you retired, possibly. You don't have to buy a supplement ever, but it's a good thing to have. You can enroll 3 months prior to turning 65, but you can only enroll in Part B when you get your Medicare card, because you'll be flipping it over on the back, and I'll show you in a minute. So what you're going to want to do is, if it's 3 months or less till your birthday and you haven't heard from Medicare, you're going to want to jump on Medicare.gov, and you're going to want to apply. You can apply online right there and make sure they know that you are out here and you need your Medicare card. So let's talk about the coverage of Medicare Part B. It covers doctor services, it covers outpatient care, it covers a welcome to Medicare visit, and preventative services like flu shots, and there's a whole list of preventative services you can Google, and it covers ambulance services. Now, Medicare Part B on the coverage, it covers cancer screenings and chemo, diabetes screenings and supplies, durable medical equipment, limited chiropractic, vision and hearing, occupational therapy, physical therapy, and laboratory services. So let's talk about the out-of-pocket cost for Medicare Part B. So your premium is going to be about $104.90, at least for most people, and that's deducted per month from your Social Security check. Now, if you're not getting a Social Security check yet, then you're going to have to get with Medicare and Social Security, and they're going to actually Medicare, not Social Security, and they're going to charge you. They're going to send you a list bill, and that usually is a 3-month deal, so quarterly. So you're going to be kind of shocked when you get your first bill, because it'll be 3 times $104.90, or whatever your monthly premium will be. But if you're on Social Security, it'll be deducted right out of your Social Security check. The deductible for Part B out-of-pocket cost is $166 per year. So if you go to the doctor and show your card and haven't paid your deductible yet, they're going to ask for that $166 right off the bat. So that's why it's also important to have a Medicare supplement that can take care of that $166. The co-insurance, 20% of Medicare approved charges. What the heck does that mean? Well, that means that if all you had was Part A and B and you had no supplement and you went to the doctor, you're going to pay 20% of Medicare's approved charges. And that's why it's important to ask the doctor if they accept Medicare approved assigned charges. So that, let's say you went to the doctor and the doctor's cost was $157 to see the doctor, and Medicare came back and said, well, our assigned rate is only $100, so that's all you can charge. The doctor can't come after you for the extra $57. They can only collect the $100. Now Medicare Part B is going to step in, and they're going to pay 80% of that $100. So you're going to be responsible for 20% of the Medicare approved charges. So in that case, it would be $20. And we'll look at an example of that in a moment on another slide. Now this is a A-B chart. So this tells you on the left Medicare Part A, that's the hospitalization, and on the right Medicare Part B, which is the medical. On the left, under Medicare Part A, all the parts in blue would be what you would be responsible for. We talked about before, if you went to the hospital, you'd pay $12.88, and all the different days if you were in there a long time. And so, you could be responsible for a lot of money if you didn't have something to pick that up. So that's what Medigap can take care of, and that's why it's important to look at the Medigap policies and find something that is workable for you. The Part B on the right, it's not in blue there, but it's a third column is what you would pay. And so there are some gaps. Really is what this is demonstrating, is there are some gaps that A and B do not cover, and that's why Medigap policy with a proper Medigap policy, or your policy from work, can cover those things that Medicare does not cover. So as I said, the Medigap policy is going to cover those things that Medicare doesn't cover. So the gap is what the senior pays. Those are the deductibles, the co-insurance, and the co-pays. And Medicare pays 80%, and the senior pays 20%. And then there's something called excess charges also, where the senior is also responsible for. Let's say you went to a specialist. Let's say you had surgery, for example, and the anesthesiologist, which is a specialized physician, is putting you under. They are allowed to charge 15% more than Medicare allows, which isn't a lot, but those excess charges, if you don't have a proper plan, you will be responsible for those excess charges. So Medicare supplement plans, also called Medigap, There are 11 standardized plans available. These are standardized by Center for Medicare and Medicaid Services, and then they're offered by private insurance companies, and there's many of them, and many of them you may not even heard of. You probably have never heard of United American until today, but United American's been around since the beginning. United American, what I like about them, they offer 10 of the 11 plans. Other companies only offer 3 or 4. All companies, if they offer any plans, have to offer the best plan, which is the F plan. It's only the best because you never have to worry about taking care of the bills, but you're paying a high premium every month for that um, comfort. And some people find a comfort in, I'll just pay a high premium and I won't worry about it. And other people would rather manage their money, and we'll see another way to do it. At any rate, these are the 11 plans across the nation. And if you buy an F plan with Blue Cross or Blue Shield or United Health, their benefits are exactly the same as far as your health goes. They pay exactly the same. The price of the plans are a little bit different, so you'd have to look into it depending on which plan you're interested in. So as I said, United American Medicare supplement plans, they're available in every state except for New York, New Jersey, and Massachusetts. And I'm not sure about Minnesota there. It looks like it's not available, but then it has an available above it, so I'm not exactly sure. But at any rate, we don't have to worry about it. We're in California, and they offer 10 of the 11 plans to Californians. So Medicare supplement plans, all MedSup plans are guaranteed renewable. And that, in other words, if you have one, you don't ever have to worry about getting sick and them dropping you. They are guaranteed renewable as long as you pay your premium. You have the flexibility and freedom to choose any doctor, any hospital, any specialist. There's no referrals and no networks. So if if your doctor accepts Medicare, your supplement plan is going to step in as the secondary. You don't have to worry about, do you take United Health, do you take Blue Cross? You just have to worry about, do you take Medicare, and do you accept Medicare assigned prices? And if that's the case, you're good to go. So all companies must follow federal and state laws for Medigap policies. That's why I said if you buy an F plan from one or the other, the exact same F plan. The costs vary by the company, and they vary by where you live and the plan that you select. And the companies vary by their ratings and their stability. So here's a picture of the Medicare supplement plans that are offered by United American Insurance Company. And you see on the left there in black the basic benefits of the Medicare Part A and B. And we talked about all of those figures. And then you see across in green and blue there all the different plans offered as Medigap plans by United American. Now you'll look across and you'll see 100% check marks and 50% and all of that. Those are the percentage that is covered by those plans of the parts of Medicare that's not covered. In other words, if you look at the F plan there, you can see that Medigap Plan F would cover all of the parts of Medicare that Medicare doesn't cover. Now, in the foreign travel emergency, you'll see that in the F plan, if you were traveling overseas, your Medicare card won't work overseas at all. But if you had a supplement plan, that would step in, at the F plan, would step in and pay 80% up to, well, it says 80%. I think it's up to $50,000. So if you are traveling overseas, you probably want to look into travel insurance. You can certainly talk to me about that as well. But what I wanted to point out here is that the HDF plan that's right next to it, it operates just like an F plan. but you can save a ton of money by taking an HDF over an F plan. You can still go to any doctor you want. It still works exactly the same, but as you see on the bottom there, the calendar year deductible or out-of-pocket annual limit. For the HDF plan, that high deductible F plan, that's $2,180. Now, a lot of people shy away from that for that reason. However, you don't have to pay $2,180 every year. It just depends on how many times you go to the doctor and how much your bills are. If you just go to the doctor a few times a year and all you're paying is $20 copay from your doctor appointment, then you're saving yourself a ton of money by going with a high deductible F and still having all of the coverage that an F plan provides, and knowing that you'll never have to pay over $2,180 a year should something happen to you. The other thing I just wanted to mention that United American has over all the other companies about the HDF plan, which I love, is they have a side account. It's where you can put money into it and they'll give you 3% fixed interest. And you can only buy it if you buy one of their plans, their HDF plans, only after. But the thing is it then works like an F plan. So when you go to the doctor and show your Medicare card and they bill United American, if you have this side account set up with them, then they'll take the money out of there and they'll pay your medical bills, and so it works exactly like an F plan because you never see a bill. You just have to remember to put money in the side account. You can put in $50 a month. You can put in $50 anytime you want. You don't have to put it in monthly. And you can build it up over time. And so that's a nice feature of that high deductible F, and you'll see the difference in pricing in a minute. So how are Medicare supplement plans priced? They're either issue age rated, and that's based on the age when the policy is purchased, or they're attained age rated, and that's based on the policyholder's birth date. United American's Medicare supplement plans in California here are attained age and issue age rated. So premium changes annually on the policyholder's birth date, and the premium is based on the age when the policy is purchased. And preferred rates, we have our preferred rates are for no tobacco use. So if you're using tobaccos, you'll pay a little bit more than the people who don't smoke or chew tobacco. So rate adjustments, the reason for them is it helps keep pace with the rising Medicare claim trends and the changes in the annual deductibles. Medicare supplement open enrollment qualifiers. So you have to have parts A and B in order to make some changes during open enrollment. You cannot be denied during the open enrollment period. You can't be charged more because of your health. The Medicare supplement guaranteed issue qualifiers on Medicare and involuntarily disenrolled from your employer's group health plan. So if your employer dropped you, then you're able to pick up a Medicare supplement and you're guaranteed issue. If you're involuntarily disenrolled from your Medicare Advantage plan, you're also have another guaranteed issue qualifier. And there are other guaranteed issue qualifiers. So you're going to have to, if something happens and you have to make a change, you have to reach out. You can reach out to myself, or you can look up on Medicare.gov the other types of guaranteed issue qualifiers. But if you're outside of open enrollment, you must go through underwriting. Except in California, we have what they call a California birthday rule. And in California, you are able to also change your plan during your birthday month. So Medicare Advantage 2015, these are the dates, and we assume that they'll be the same for 2016, but we don't control that, so we leave this for 2015 right now. But normally, pre-enrollment period is October 1st through October 14th, and the annual election period is October 15th through December 7th, and the annual disenrollment period is January 1st through February 14th. So that means you can enroll during October 15th through December 7th, and you can disenroll between January 1st and February 14th. It's kind of confusing, so if you need some help, just give me a call. So premium savings, let's talk about how do people save money on any kind of insurance, health, car, homeowners. The answer is, of course, they raise their deductible and save premium money. You can do the same thing with Medicare supplements, and I'll show you how. So a popular Medicare supplement plans, like I say, the F plan is very popular because it pays everything and you don't ever have to worry, and so people just assume that's the best plan. The HDF plan, like I said, works just like an F plan, and there are a little bit of differences. The only difference is when you go to the doctor, you're going to pay that 20% until you reach the 2180. But you will cap at 2180, so if something horrible happened, you wouldn't pay more than 2180. Now in the foreign travel, you see there's a $250 deductible on foreign travel, and it is a $50,000 maximum. So they'll pay, both of the HDF and the F plan pay the same. They'll pay 80% up to $50,000 with a $250 deductible. So let's look at a HDF claim example. Michelle here has an HDF policy, and let's see what happens when she has a Part B claim. So her total Part B doctor claim was $100, and Medicare paid 80% of it, so they paid $80. And the customer is responsible for the other $20. Now, if she had already met her deductible in 2016, then it would be zero, just like an F plan. But since she hasn't met her deductible yet, she's going to be paying that $20. Now, that $20 will go towards her $21.80 for the year. And so that's capped at $21.80. If something horrible happened, she wouldn't have to pay more than $21.80. So how does an HDF, how would it be suitable coverage for senior health needs and the budget? So let's look at a husband and wife. They both took the F plan, and they've been paying a premium of $172 a month each. And they're going to switch it up to the HDF monthly premium, and that for them in their area is $31 a month. So they're going to have a monthly premium savings of $141 each. So that's quite a bit of savings, and that money can set aside waiting for something to happen, so you're not giving it to the insurance company up front. So looking at that same husband and wife, the scenario we just looked at, they're having a monthly premium savings of $141 a month each. If you multiply that times 12 months, they're saving $1,692 a year each, and so for a combined annual premium savings of $3,384. So instead of giving that money up to the insurance company, they have that in their pocket just in case something happens and they need to use it. So looking at that same scenario, the husband and wife, potential premium savings over a 10-year period. So they're each saving $1,692 a year because they switched to the HDF. And if you multiply that times 10 years, they're each saving $16,920. And if you combine that, because they're husband and wife and all their money's combined, they're having a combined premium saving now of $33,840 for that 10 years. If you think about it, and if you're going to be on Medicare and be still kicking for another 20 or 30 years, you can multiply that out for yourself and see how much you might save. So Which plan is right for me? If you're turning 65, you have this one-time open enrollment period, and the decision you make today affects the quality of your care tomorrow. So it is really important for you to take a good hard look at what is available and what is right for you. So which plan is right for me and how do I choose? Well, do you want the flexibility and freedom to choose your own doctors? I think so, yes. And how do I choose which plan is right for me? Do you want to choose your own specialist without referrals and not worry about networks? I think so. I do. Yes. And how do I choose which plan is right for me? Do you want to choose the best cancer treatment facilities available? I sure would. Yes. And how do I choose which plan is right for me? Well, do you want to pay a lower premium to save? Well, maybe. And how do I choose which plan is right for me? Do you want the flexibility, security, and stability of a guaranteed renewable Medicare supplement policy? Well, yes. How do I choose which plan is right for me? Well, do you want a plan that includes foreign travel? Maybe. And how do I choose which plan is right for me? Well, I'm not sure what my health will be like 3 to 5 years from now. Should I consider a lower cost plan and switch to a better plan down the road? Maybe. And how do I select an agent? Well, do your homework and choose an informed local agent. Okay. Do your homework, ask about their qualifications and designations. Okay. How do I choose a carrier? Well, choosing a carrier is very important. And why is an A+ superior rating important to me? How long has a carrier been in the MedSup business? And why choosing a carrier is important, you got to know how quickly do they issue policies and pay claims. And also choosing a carrier is very important. You want to know if they outsource their customer service call center or is it here in the United States. United American is here in Texas and they pride themselves in answering on the first ring with a very happy Texas hello. So I'm very proud to represent United American Insurance Company. They've been in business since 1947, and they're one of the nation's leading writers of individual Medicare supplement plans. Their industry ratings are A+ superior. That's the second highest financial strength rating from AM Best Company, and that's been for more than 35 consecutive years. And they also have an AA- very strong financial strength rating from Standard & Poor's. So I am very happy to represent United American, and I think that the HDF is worth taking a look at. Thank you very much for attending. If you have any further questions, I know you will. I am available. You can try to reach me 7 days a week from 8 a.m. to 8 p.m. And my phone number is here on the slide as well as my email address. I'm going to leave this up for just a moment so you can copy it, have time to copy it down. Just give me a call directly if you have any questions at all, or if you just want to, if you get on Medicare.gov and you're having some trouble on how to maneuver, just give me a call and I can at least point you in the right direction. But I'd be happy to write your Medicare supplement plans if you decide to go with United American, or if you want to look into others, you can give me a call. There's my number. Thanks very much.